it's this. It will tell you that where PhilHealth is concerned, PhilHealth mainly covers the blue, which is inpatient care, including the Z benefits, the dark blue. So PhilHealth covers mainly inpatient care. The rest are administrative benefits and some primary care, which we're trying to roll out. With this in mind, we have to go then to the idea of what happens. How does the system actually try to provide the care? And the Secretary Garin said, you get it from out-of-pocket expenses, but you also get it from national government. And the reason there is so much out-of-pocket expense is this, and this is a confusing slide, I actually changed it, but if this is out-of-pocket in the middle, and you just look at 10 o'clock, pay for an out-of-pocket drug. Think of yourself as a patient who goes to the hospital. If that hospital, as Secretary Garin says, does not stock magnesium sulfate, for example, if you're a pregnant woman who has just delivered, or you need an antibiotic, or you need an IV fluid and there are no stocks, you pay out of pocket. So actually, what our system does is that because it has to cover the cost of care, it gets that coverage from out of pocket, from the client. But we want the system to cover our health care. What the figures are saying are that, and again, if you just look at Region 12, this graph should be read horizontally. This is the prevalence of catastrophic expenses, meaning to say it's catastrophic on the family, and these are the years. But if you just look at Region 12, which is one of the highest percentages of catastrophic expenses, what this graph is saying is that from 2000 all the way to 2012, and this is data of Oscar Picasso, out-of-pocket catastrophic payments have actually been increasing in Region 12, and if you look at any other region across all regions. Is that because healthcare is getting more expensive? Is that because people are spending more for healthcare? But this is the data that's being shown. So with that, and you start to dissect what out-of-pocket is, this graph should be read this way. Each one is a quintile, and this is the poorest quintile. The first bar is the poorest quintile. And this is the richest quintile, and this is the total. This is dissecting out-of-pocket expenditures. Where is it going? It's going mainly, particularly for the poorest sector, in buying medicines and in inpatient services. That's where our out-of-pocket is going. Very little for outpatient care. And across the quintiles, you can see that is the case. But for the richest quintile, which is the second to the last bar, you can see that, well, inpatient care will go up because many of these people are going to tertiary facilities. This is the dissection of out-of-pocket expenses. Now, what we need to go then is look at what happens as a country which is in the low-middle income bracket. This is the Philippines now, and this is our profile. We have a profile here in the middle bracket. Our out-of-pocket expenses is in the neighborhood of 50 to 60%, and that's looking at it from the macro level. That's of total expenditures. What this slide is saying is that as our society becomes more affluent, hopefully because our GNP grows, There's more government expenditures on health. As we move towards higher income status, out-of-pocket is going to decrease, as has been the experience of many other countries. But this transition from high out-of-pocket to low, because we have become more affluent, is not going to be automatic or inevitable. We will have to work out our policies to achieve that. So, I'm supposed to conclude, because I don't want to talk very long, but before concluding, let me show you this slide, of which is really the system that we have. Let me just tell you the story of Juana, who is this patient with sick care here. If she's sick, she's faced with a number of alternatives. If she's seriously ill, she can either go to a government hospital or a private hospital. And I'll tell you a story, which I know which is true. A friend of mine had his maid, kasambahay, had a stroke. She collapsed in the bathroom. My friend took her to a medical center here in Manila, private, where they did the scan. They diagnosed the stroke. She was about to admit it. Then my friend called me and said, if you're going to admit that patient in that hospital with that condition, and you're going to cover the expenses, then you'd be prepared to spend in the millions. So because I was his friend, I was able to make an arrangement to go to a government public hospital, where the patient was then cared for there. They made the assessment. She needed an operation. They could have done that in that hospital, but the hospital's neurosurgical microscope was out of order. So I made arrangements to have that patient transferred to another public hospital where the operation was made. It was a successful operation. 6 weeks after that patient got a stroke, she was discharged. She's actually gone home to her province, and I'm helping make a referral to the region, to the medical center in that province. When I reflect on that, that was one experience of one patient who I helped navigate the system. What happens for people that don't know how to navigate the system? Now, this lower section here is only inpatient care. This is the section on primary care, where they can go to an laboratorio, an RHU, a health center. But along the way, you can see is all of these red bars that say out of pocket. It says that as you go through, that person is going to have out of pocket expenses. I had a slide, but I'll just tell you the story of, because our school works in Northern Samar, of a 1-year-old infant that needed care. She had to go from a remote island to go and seek care in the district hospital, eventually to the provincial hospital. But that poor family had to spend about 5,000 pesos out of pocket to be able to get the care. From the transportation, lost wages, and so on and so forth. PhilHealth covered about 1/3 of those expenses for that poor patient. So I guess the question that we really have to ask ourselves as we move towards this in our concluding remarks is, certainly this administration has widened access to quality services, particularly for inpatient care. We now have the Z benefit package, but that's mainly in government hospitals and maybe some selected hospitals, but it's widened it. It's widened people enrolled in PhilHealth, almost 100%. But when we talk of out-of-pocket expenses, the financial risk protection is really, realistically, only in the neighborhood of 30%. And for some families, 30% expenditure could be catastrophic. And finally, when we talk about the MDGs, and we know that the Philippines did not achieve the MDG goals, but it goes back to this diagram, because we're talking of a sick patient here, having to navigate the health system that provides curative care. The question is, what happens behind this patient? All of those services, all of those programs that should prevent this patient from getting sick. Are we creating a system that's just going to provide and service this? Where are we? If you were a mayor, would you spend your scarce resources in contributing to your district hospital? Or would you build the water system in your municipality and give people clean water? Is that an either or is that both? So, I will end there, because we'll still have the panel to discuss it. But mainly to conclude and say, if you look at a reality check of where we are now, we've had huge advances. But it's still not cutting it. And when we think about out of pocket, we have to be careful to think about what the system can provide and what the system can bear. Because we can all say, out of pocket is high, but who's paying the premiums? And how is government going to deal with that? And finally, the whole thing about the whole system having to work together, which is the theme of Secretary Guerin. How do you get people to have goodwill and not game the system? Get the most out of it, raise the prices when the PhilHealth premiums go up. How do you provide that moral compass for people to actually feel part of a health system? That's all we've got. Thank you very much.